I would like to talk about Lyso-GB3, which is a very helpful biomarker in management and treatment of Fabry disease patients. And as you all know, we have GB3 or global triacylceramide, which is a bad guy accumulating in the multiple tissues. As you can see here in the vasculature, in the brain, in the kidney, and in the heart. And you all everywhere can see this typical myelin figures, which can be distinguished particularly well on the electron microscopy of the tissues. GB3 is a substance of which you can see the molecule here, and this bad guy consists of the 3 sugar heads, like shown here, and of the 2 arms, fatty acid arms, like shown here. But it is difficult to measure this agent or this metabolite in the blood, because for this you would need a tissue biopsy. Recently, it has been discovered that if the molecule loses one of the both arms, and you have this bad guy with only 1 arm and the 3 sugar heads, then this is another biomarker. However, this biomarker is soluble in the fluid, and this is why we can measure it in the blood or in the urine. And this is very helpful that we have this tool, because we can observe that this biomarker already increases at the time when the baby with Fabry disease is born. For example, you see here that we have a family with Fabry disease. This is the mother with her children, and these 2 have inherited this nasty mutation. And we are looking at 2 brothers. One is newborn and the other is 14 years old, like here. This is newborn, this is 14 years old. And this in the middle is the youngest, but at 5 months. So in the youngest brother, we have 2 measurements, one at 2 days, so you can say in newborn, and then later on 5 months. And these values of Lyso-GB3 are compared to the value of the older brother, which of course also have the same mutation. And what we can see that the Lyso-GB3 level, which is shown on the y-axis, is already increased over the healthy control at day 2. And it continues increasing at 5 months, and finally it has its highest numbers of around 100 nanograms per milliliter at the adolescent age, or better to say this child is already 14 years of age, and then the Lyso-GB3 plateaus over the lifetime. Lyso-GB3 is related to the phenotype. I heard in your discussion before that you were discussing about the 2 phenotypes, the classic phenotype and the later onset phenotype. And this on this diagram, I'm showing the Lyso-GB3 levels in males and females in classic later onset and healthy control groups. And as you can see, in the classic males, the Lyso-GB3 levels are particularly high. And then you have here the males with a later onset phenotype, and these are the values in the middle. And of course, in healthy controls, we have very low Lyso-GB3 levels. And the same pattern you can observe in the females, but in the females you see that we have values up to 30, and while in the males we have values up to 150 nanograms per milliliter. The same in urine, we can see a similar pattern in the urine. And if we have urine, of course, then we have a less invasive assessment in order to diagnose and distinguish between the two phenotypes. Lyso-GB3 can be, as already mentioned, measured in the blood, and it can be sent in a tube to the laboratory, but needs to be cooled on the way. However, since recently we have another possibility to transport or to send Lyso-GB3, which is possible on the dry blood cards. You take a little bit of blood, 1 drop is enough, you drop it on a card, and then you let the card dry in the room for 2 hours, and then you can put it into an envelope and then send it off via postal way completely normally, and then this Lyso-GB3 level will be stable on this dry card. It is also DBS. This means dry blood sampling. And this is then still a reliable value that you can get from it, and but it is very easily sent to the laboratory. Lyso-GB3 can be helpful for the diagnosis of Fabry disease, and it is particularly helpful sometimes in females. You know that in females, we can measure the enzyme activity in the leukocytes like we usually do with men, but in females, it's not always indicative for Fabry diagnosis. In these cases, where we have normal alpha-galactosidase levels, and this is an example of 3 of our females, they have a classic Fabry disease, they have normal alpha-galactosidase activity in the leukocytes, but you see in all 3 that Lyso-GB3 levels are increased. Here you can see the normal range, and here you can see the results of these 3 females. And you can see this GLA mutations. That means that they have the mutation for Fabry disease. They all have classic phenotype. They are all 3 receiving enzyme replacement therapy. They have specific signs and symptoms of Fabry disease with a cloudy cornea, and one of the females has angiokeratoma and 2 suffer from acroparesthesias, from burning pains, so that you see they have really Fabry disease, but they have a normal enzyme activity in the leukocytes, and but the Lyso-GB3 levels are increased. And this is helpful because sometimes we don't understand well mutations, because not all mutations are already described, and sometimes we have unspecific symptoms, particularly in females. In these cases, we can measure the Lyso-GB3. And you see that one of these females have these symptoms which are typical for the classic phenotype. And here you can see cornea verticillata this cloudy specific cornea that we observe in Fabry disease females. So that we concluded that Lyso-GB3 is a useful marker for the diagnosis of the females. Lyso-GB3 is also helpful to reflect the genotype severity. If we have particularly severe mutations, which are deletions, that means that a piece of the DNA is broken away, then we will have higher Lyso-GB3 levels in the blood compared with the patients in whom we have only one piece is exchanged in the DNA. In both groups, we still have increased Lyso-GB3 levels, but in the more severe genetic mutation, we have higher Lyso-GB3 levels. This is what we were able to see in our Fabry patients. And I have plotted the Lyso-GB3 levels in these 7 Swiss families. You see here the column each represents Lyso-GB3 levels of each family. And in yellow you have males, and in blue you have females. And of course, females have lower Lyso-GB3 levels as males in the respective family. However, if you look inside or within the same family, we have here 2 males, where in this male we have a higher level of Lyso-GB3 than in this male. But we also know that this male is more severely affected because his kidney deterioration started already earlier and progressed more rapidly, so that he reached his end-stage renal disease already 8 years earlier than his brother. Then in this second family, we have Lyso-GB3 levels, and I emphasize this of this female. This female has the highest Lyso-GB3 level, and we also know that she has the most severe disease because she suffered several strokes and she cannot walk and is wheelchair bound, while these females have Lyso-GB3 levels which are lower, and they are less affected by the disease. And then if you look at this female, she has the highest Lyso-GB3 level. She is not yet on therapy. This is why the level is higher. So that Lyso-GB3 is also associated with the treatment. And then in this same family, we have these males which have such higher levels, and however, this male has much lower levels, and it's also known that both males have end-stage renal disease. So the one has kidney transplantation, the other is on the dialysis, but this male is much less severely affected. His kidney function is almost normal, and he also suffers less pain than his relatives, with the same mutation, of course. Lyso-GB3 is not only a biomarker that can be measured in blood, of course, but it is also a pathogenic player. This means that this agent promotes the disease progress. And it has been shown that if you measure a certain level of this biomarker in the blood, it will be associated with the kidney disease, with the heart disease, and with the cerebral vascular disease. That means with the brain disease. And here is what you can see, what happens if you initiate a classic Fabry patient on enzyme replacement therapy. Before the initiation, you have high Lyso-GB3 level. Then you start with the infusions every other week. And after 3 months, the levels will stabilize. They will decrease and then stabilize. If you then measure after 3 further months the Lyso-GB3 levels, then they will remain as a plateau. So that we know when we need approximately 1 to 3 months in order to decrease the Lyso-GB3 following ERT or enzyme replacement therapy initiation, and then it doesn't change so quickly according to the therapy. That means if we do the therapy regularly, the Lyso-GB3 would stay approximately stable. And this is what happened in Europe when we have the shortage of the enzyme replacement therapy in the year, I think, 2007, where we had not enough enzyme replacement therapy. In some patients, the therapy was reduced, the dose was reduced. In other patients, another drug was added. In Europe, we also had agalsidase alpha. In US, you have only agalsidase beta. And this agalsidase alpha has a lower dose. And this is what happens with the Lyso-GB3. Before the shortage, we have lower levels. And after the shortage, that means following the reduction of the dose, the Lyso-GB3 levels increase. And here we can see that Lyso-GB3 decreases more properly or more profoundly in the patients when we start with enzyme replacement therapy earlier. In this group, or better to say in this study, the patients were divided into 2 groups. The one group on treatment younger than 25 years, and the other group with treatment with over 25 years. And you see that in the early treatment group on the left side, the Lyso-GB3 level decreases more profoundly and remains quite low compared to the late treatment group. And this is a study with our Swiss patients in whom we had a stable enzyme replacement therapy at a lower dose. And then we increased them to the higher dose. And what you can see that uniformly in all patients, Lyso-GB3 further drops in the patients following the switch. Lyso-GB3 is also helpful in order to estimate the prognosis. We divided our patients into 2 groups. The ones had a higher Lyso-GB3 level. This means higher than median. And the other group had a lower Lyso-GB3 level, which was below the median. And then we looked how fast clinical complications, such as, for example, stroke, indication for renal replacement therapy, for example, renal transplantation or hemodialysis is necessary, how fast we need a pacemaker, or how fast patients die. And when we look on this compound endpoint, then we see that in patients with a higher Lyso-GB3 levels, we have much faster the occurrence of this clinical event. And it is also known that classic Fabry patients have a kind of COPD. This means a lung disease where their bronchi will be full of GB3 deposition, full of this bad guy, and this leads to the narrowing of the airway. And this disease can also be progressive, and this results in our patients in whom we see that Lyso-GB3 level, in patients in whom the Lyso-GB3 level is the highest, their lung disease progresses faster than in patients in whom Lyso-GB3 is lower. And this is the final slide with a study I wanted to show you. This is a very recent Dutch study. The colleagues measured Lyso-GB3 in patients who are not yet on treatment, and then they looked how fast their kidney disease progresses, their heart disease, and their brain disease progresses. And they also found that the steep decline in the kidney function is associated with the higher levels of Lyso-GB3 before treatment, as well as the heart mass increases faster in patients with a higher Lyso-GB3 values, and also a faster increase of specific white matter lesions, which are specific changes in the brain seen on the MRI. And I would like to conclude, Lyso-GB3 can help us to diagnose Fabry disease and also to distinguish between the two phenotypes, the classic and the later onset. Lyso-GB3 can reflect the disease severity and is a helpful marker for the disease therapy monitoring. And Lyso-GB3 is also associated with the long-term disease progression and with the occurrence of the relevant clinical events. Thank you very much for your attention. And sorry again for the technical challenges.
Thank you very much, Dr. Nowak.
You're welcome.